Welcome to our broadcast, The Path to Be Well. To all our listeners, we're so happy that you have joined us. Please note that you can also find us on YouTube or on weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and will help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do us a favor and them a favor by sharing this event. My name is Mark Trombley, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were opened. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, we have served nearly 6,000 patients, ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one size fits all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So for those of you who have joined us in 2020, we've had numerous guests, and we have heard that they have been beneficial to our listeners. Guests who would share their stories. And today I have the pleasure of introducing and having with us Jerry, who became a client at Simcoe Holistic Health, now Weedwell, in December of last year. So, Jerry, welcome.
Thank you.
I'm not sure what all the background noise is at this point.
Well, I mean, there's a heater on. Maybe that's getting noise. Is that better?
Yeah, that's good.
Okay.
Thank you. So, Jerry, although recently retired from your everyday profession, I understand you're also keeping busy, doing many other things. So I appreciate you making the time to be with us today. And as I mentioned before, patients often can relate to stories that they hear, and so many times they're sitting, I'll say, on the fence for their own specific reasons. But then when they hear a story that they can relate to, often it's enough for them to, make that decision to consider cannabis as an option. So thank you for doing that. So Jerry, I understand from an earlier conversation with you that you have always had somewhat of an active lifestyle. Can you summarize that for me, please?
Okay, I've basically, as you say, yes, I have. I've golfed for many years, and one of the things I've always done golfing is walking the golf course. And it's a fairly hilly course I play at. I exercise regularly. I have a gym in my basement, exercise bike and elliptical, free weights. And I have a personal trainer once a week who comes in and puts me through the grind. Winter, I do cross-country skiing, I do snowshoeing. So always going well till this summer.
Yeah. And what happened that changed, Jerry, if you don't mind
Well,
sharing that?
what I do, I know I have some arthritis in my knees, um, and everything was fine. I was walking the golf course. Then about August, one day I was playing and started getting severe pain in my knees. Hit a drive, started getting severe pain, and it didn't really improve. Went to the doctor. She prescribed Celebrex, which is COX-2 anti-inflammatory. And I was also taking Tylenol muscle and joint. I also teach laser, so I was using a low-level laser. And I was helping to manage the pain, but it was still enough that I couldn't walk the golf course anymore. I couldn't do any of my lower body exercises. And at the end of the season, I basically had to shut the golf season down early. And along with that, I went and had an X-ray and an ultrasound done. I found there's severe arthritis in the knee, there's a cyst in the back of the knee showing severe degeneration of the knee. And I got a little piece of cartilage calcified floating around. So I said, I don't want a knee replacement. So I started investigating, and I did talk to people, seniors around me, to use CBD and swear by it. Also, because I'm involved in health field and treating facial pain, I consulted an orthopedic surgeon. We did a procedure called PRP, which is basically they remove the blood cells and stem cells, healing factors get injected into your knee. And when I was there, I asked the surgeon, I said, well, what about CBD? Do you think it'd be a compliment? And sorry about that, just a little tickle. He actually said he recommends it, that patients do the two combinations because they have better results. So that's how I got doing it.
Well, that's awesome. So you've described that, a lot of what you so enjoy doing it and were presumably passionate about came to somewhat of a standstill for the most part. CBD was introduced into your treatment plan, I believe you said early January. So can you tell us a little bit about that and the kind of dosing and the progression that you've witnessed?
Well, I was taking, as I say, I had the PRP, and about a week and a half later, I got the CBD oil and started taking it, building up. I started off at 0.3, 0.5, and basically now I'm taking the full recommended dose of 1 milliliter twice a day. And what I will say now, I would say, with doing all the different things, my pain, I would say, is 95% improved. This morning I did an hour and a half workout, 45 minutes in the bike, 45 minutes upper weights. Twice this week I've been snowshoeing, all basically, with very minimal pain. In fact, I'd say the pain's no different than my other knee than what I'm getting in this knee. And I think the big thing is I have not taken a single pain medication at all, basically since Christmas. So I'm very happy, and I'm basically back to resuming my life.
Well, that's amazing. And I will let our audience know that this is great news from Jerry, but this may not necessarily be typical either, because we always say that cannabis is not a miracle drug, but it does help alleviate symptoms, and it's not necessarily for everyone. But obviously, Jerry, I mean, in a matter of weeks, things have changed considerably or dramatically for you.
Yeah, and again, I agree with you, because actually, as I say, it's a combination of things I've done. I've had the PRP, I still do the laser on it, I use the CBD. So it's, it may not be a miracle cure, but it's part of the miracle cure.
Well,
and
when I hear you say that,
and I think it'd be successful, I don't want surgery. I don't want a knee replacement.
Yeah.
And I think I can avoid that.
That's awesome. So for those people that might be considering cannabis, that may have their own reasons why they would be reluctant to do so, that could be stigma, the fear, the unknown, those sorts of things. So what would you have to tell those people that might be listening in today?
Well, I would say the simplest thing of all is there's really no side effects. I take it twice a day. It doesn't affect it. I would say the only probably thing I would say, I'm probably sleeping better. It's helped with sleep. But in terms of any type of psychogenic side effect, there's absolutely nothing. So it's no different than if I took any other medication. But the beauty of it, it has no side effects.
So you don't wake up in the morning feeling groggy as a result of it.
I feel great.
Because some people are concerned about putting on weight if they do start a cannabis treatment.
No, I'm actually trying to lose weight and I've been losing weight. So, I mean, so it's not a problem, as I say. To me, it's as if really I'm not doing, other than the fact that I'm getting results, I don't notice any side effects at all. I don't know if I'm unique or not, but that's my findings. I found just building up was very easy.
Yeah. So based on what I'm hearing, would it be safe to say that you would certainly recommend for anyone considering this to explore it under the care of medical professionals?
Absolutely. Yeah, that I will say that when we did the interview first for doing it, part of it was consulting with a physician who basically recommended the doses, which as a dentist who has prescribed, that made me feel much better.
Yeah. And just out of curiosity, and this is not a judgment, Jerry, but were there any preconceived notion before others in your circle recommending it, say a year ago, about cannabis? Because I know I was one of them, but I'm just curious to know.
I read a lot about pain literature, and I've started to see it. My big concern was that I get the CBD oil by itself. I think that was the big thing. There's actually been talks before using marijuana for pain, and I had no interest in that.
Mm-hmm.
I have trouble enough with my mind at 73 now. But once it was the CBD and I could read the research, absolutely no hesitation at all.
That's amazing. Any closing comments, Jerry, for anyone who's listening live or that might be listening to this podcast moving forward?
The only comment would be if you've got chronic pain, investigate it. It's one more tool, and it's certainly a lot better than the medications. It doesn't have any of the side effects that the medications you're taking do.
Exactly. Now, how strongly or not do you feel about starting the treatment with CBD or cannabis in general under the care of professionals, or do you think that it's prudent to even try this on your own, because it is available in different areas today?
Well, basically, what I recommend is find somebody that knows what they're doing. It is a medication you're using. You want to get a result. Go to the experts and let the experts tell you what to do. That's my opinion.
Yeah, and we didn't pay you to say that, did we?
Well, I teach courses all the time, and that's what I tell people.
Yeah.
I teach lasers, and it's using the dose right. And that's why I teach people how to do it right. So I believe going to the professionals.
Okay. Well, Jerry, and I'm sure our audience have enjoyed hearing your story. And I will caution individuals again that, it may not be this effective and this quickly for anyone else. Not that this is a first, but it's always great to hear these stories. And one of the reasons why I asked you to join us today. So, Jerry, thank you so much for making the time to join us. I'm really happy to hear that you're back doing those things that you so much enjoy doing. And we'll thank you, and we'll keep in touch moving forward.
Good. Thank you, Mark. Enjoyed it.
Okay. Take care. So again, for our listening audience, I cannot stress enough, you've heard me say this a couple of times and worthy of mentioning again, that the information that we share on these podcasts or live streams are about, in this case here, a specific person with specific condition. And no one listening to this should ever use this as a diagnosis or treatment plan for yourself or even for a loved one. We always encourage that you would speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those who have taken some steps in improving their quality of life, we say congratulations. Remember that your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you are making. And at Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So I trust that you have found this information valuable today. And perhaps you're one of those that was sitting on the fence, and that this would prompt you to take the next step. And the next step is to seek professional advice that would be able to guide you in this consideration of cannabis for your treatment as an option. So on behalf of Weedwell, myself and the team behind the scenes, I thank you. And until the next time, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.